department at the emergency department at London Health Sciences Centre here in London, as well as in a small rural community where I'm from, a couple hours north. So I've worked for about almost 5 years as an RN and just in the emergency department capacity. And then almost 2 years ago, I guess now, have gone back to school to the MN Primary Healthcare Nurse Practitioner program at Western. So I'm just coming up to the end of it this summer. I'll be doing my IP and yeah.
Great, thank you, Danielle. And now finally we have Eugenia Ling, who is enrolled in the Masters of Science in Nursing program, the thesis stream at McMaster University.
Hi, everyone. So my name is Eugenia. I also graduated from Western University in 2019, so it's good to see you again, Danielle. So after graduating from my undergrad, I moved back to Ottawa, and I've kind of worked a bit of everywhere, like long-term care, public health, and on a medicine unit. And then I moved to Toronto to start my master's in nursing at McMaster University in the thesis stream with Michelle, actually. And I'm currently working on a medicine oncology unit at Toronto General Hospital.
Great, thank you. So to begin, so the first question we have is for the panelists is what motivated / inspired you to dive into the field of research and or enroll in graduate studies? Just feel free, who would ever like to begin to start answering.
Sure. So I had originally registered in the course-based program, and then I decided that I was, I wasn't sure if I was going to do a PhD or not. And so they sort of steered me to at least try the research sort of stream and the thesis stream, and ended up really liking it. Originally, my motivation to go to graduate school was to become a teacher, and then I wasn't sure what that meant. Whether clinical instructor or college instructor, and then sort of as I've moved through, sort of focusing on more research and the PhD sort of professor role.
That's great. Does anyone else have anything to add?
I was just going to say, so mine's a little bit different because with the NP program, we're not as focused on research as the other programs. But our first year, we do a little bit of research and stuff like that. But basically what inspired me to get involved in and to go forward with graduate studies was being from a rural area. It's about an hour and a half north of London, like the Bruce County area. And working a bit in that emerge as well. It's very evident that there's a large gap in timely, effective, and comprehensive primary care services for all of the patients there. Lots of unattached patients, not enough family doctors, only a couple nurse practitioners. The ER kind of overwhelmed with lots of primary care conditions. So the reason why I went back to school was primarily to help fill this gap. And I liked the NP role and the NP because of the requirement for the master's degree to be able to have that strong nursing foundation, but also be able to, still do research, leadership, and all the clinical aspects that come with the NP program as well.
For me, I think it mostly stems from my own personal experiences coming from an immigrant family, as well as in my undergraduate education. I think I realized that there were so many systemic barriers throughout the health system that lead to different inequities in the health system, especially for immigrants. And so for me, I pursued my graduate education to be able to explore this kind of area a bit more and to be able to advance in my nursing career.
Thank you so much for those great answers. Moving on to the next question. How did you decide on your specific program? What route was right for you? Whoever wants to answer first.
Yeah, maybe we'll just go in this little circle. I met with a few different supervisors to sort of understand what their field of research was and what they sort of were working on, and if they had something I could contribute to. I was interested in education, faculty, nursing students, and then sort of any way to support them or other people that way. So then that's my supervisor is Dr. Sheila Boma, and she studies a lot of job satisfaction, sort of the burnout that people experience, how to improve retention, timely with the retention toolkit that just came out, that sort of piece. And she had a few different projects that she was working on, so I was able to connect with her and then sort of carve out my piece of the project and what I was interested in. So there's a little bit of, you get to decide, and then also you sort of fit yourself into your supervisor's expertise.
For me, I kind of touched a little bit in the last section about primary care and seeing those kind of presentations in the emergency departments and kind of acknowledging this lack of good comprehensive primary care in the rural communities. So that's kind of, again, kind of what helped me choose my program. But in particular, I like the emphasis of the program at Western, and several universities also do like the primary healthcare focus on the NP program. Just because seeing all those worst case scenarios and like really profound illnesses in the emergency department led me to realize that it might be kind of nice to kind of look more at the prevention side of things. And I find that there's a lot of there's a lot more opportunity. Like I like the opportunity to like look at all the new guidelines, research, and apply those to patients in our primary care settings.
So when I was deciding to apply for my master's, I had applied to several different schools, but I did land on McMaster just because I know that they did have a strong graduate program. So I can't necessarily speak for other schools, but I did reach out to different supervisors. I found their bios online and then looked at what kind of interests align the interests that align with different supervisors' work. And so then I just emailed them, asking to meet with them. And then in terms of my topic, when I first entered the program, I had this very general idea of exploring health literacy and inequities among immigrants. But then throughout my undergrad journey, I talked with different immigration agencies, different researchers, and then of course, understanding what are the actual gaps in current research. And then this is how I landed on my topic, which is exploring how primary healthcare RNs promote healthcare access for recent immigrants. So the thesis process is really hard work, of course. And so I do advise that if you are pursuing this thesis route, to pick a topic that you're generally interested about, because you will be committing over 2 years to this topic.
That kind of leads us into our next question. Thank you everyone for your answers. So for those of you in the thesis-based program, how did you pick your topic for your thesis, and what was the process like for you trying to find a supervisor?
So I think, yeah, I spoke to that a little bit before, but in terms of what I'm working on now, so my master's thesis is on nursing faculty experiences, their transition experiences, particularly moving from the clinical environment to the academic. And I chose that topic. It sort of, yeah, like Eugenia said, it sort of evolved over a few different iterations of what the topic would be. And it really was a lot of sort of looking at the literature, what was there, what hadn't been studied, and then using the expertise of the committee and what they, they're in it more. So what they sort of felt was a gap. So college faculty had not been studied before. So that was sort of something that I could sort of be the first person to look into. And then I had a lot of trouble switching from clinical to academic. I had been practicing for 13 years clinically, and then went back to school, and that was like, you know, I always tell the story, I didn't even have a Word program on my computer. I'd only been, you know, charting in the Merge with my hands. So I hadn't written in a while. So it was difficult. And sort of a lot of the people who are faculty, especially in the college setting, that's their story too. Like they haven't been in that world. They're clinical experts and then are now having to be academic experts too. And then for the PhD, my background as a patient educator is related to supporting cardiac patients post-event. So it's a lot of nutrition support, exercise. I write exercise prescriptions, and then provide education and do workshops. So I ended up sort of finding some way to do that piece. So I'm focusing on health coaching. So I found a new supervisor, Dr. Diana Sharafali, who was in that world. Her focus is on diabetes health coaching, and it was like a nice fit for me for the next sort of 4 years to explore that and, you know, really make it's much more aligned with my clinical expertise, whereas my master's was more related to my personal sort of lived experience. Is that helpful?
Yeah, great. Thank you for answering. Then I know Eugenia, you touched in a bit. Maybe if you want to share a bit about like what was the process like with finding a supervisor and how was like meeting with the supervisors?
Yeah, I'll try not to reiterate anything that I've already mentioned, but I think that for McMaster, they have a lot of different supervisors out there. And so, like I mentioned, it is kind of looking at what aligns best with your own research interests as well. And the supervisors are all they love thesis students, so they're all willing to meet and to be able to engage with you. I think for me, a priority as well was the dynamic that I had with the potential supervisor, because you're going to be working closely with them for a long time. And so it's important to be able to have a good working relationship with them. And also another thing is the style of supervising as well is really important. Because for me, I'm a bit more of an independent worker. And so it was finding a supervisor whose style wasn't too overbearing, but that they would be able to work with my independent work style as well. And so that the relationship that you potentially have with the supervisor is really important as well.
Great, thank you. Thank you for sharing that. And maybe for Danielle, maybe can you share some like an overview of some of the experiences you've had in your program with like clinicals since you're in more of a course-based program?
Yeah, for sure. So the first year, it starts off very similarly to the program at the graduate program at Western called the Masters of Nursing Leadership. So it's not a Masters of Science, it's just the MN Leadership. So the first year of the NP program, we essentially take almost the exact same courses like with those students to satisfy the master's component of our degree. But along with those, we also had in these added in nurse practitioner courses that we started in our first year as well. So they're more of just like kind of an introduction. So called Roles and Responsibilities of the Advanced Practice Nurse was one of our ones last year that we had throughout the year throughout our master's courses. And then last summer we did, it's kind of a full-time pathophysiology course all summer, which is like a year round, but they put it just into the summer, and then that's the only course you do. So that was kind of like the first introduction to like kind of more intense course-based stuff. And then starting in the fall, so September, and then for 2 semesters, we have our 2 courses called AHAD and Therapeutics. So Advanced Health Assessment and Diagnosis is AHAD, and then Therapeutics is like Therapeutics of Primary Healthcare Nurse Practitioner. So you take those at the same time. We go to class on campus 1 day a week, and we're in just groups of 8 people in like our little seminar groups, and we have a seminar instructor as well that kind of leads the conversations. So on top of that 1 day a week where we actually come to campus, we also have a clinical aspect of the program. So about 2 days a week, we're in clinical placement. So last semester I was, again, I'm from kind of a rural area. So last semester I was placed in an emergency department in Goderich, working with a nurse practitioner there. And then this semester I'm with a nurse practitioner in a family health team in Brockton, working with her. So that twice a week, school the 1 day a week, and then we do all of our, obviously our readings and our studying for exams. I had an exam this morning, so for AHAD. So it's quite, they tell you before kind of going into the MP program that you can't work because there's not a lot of time. And everyone kind of always says, oh, like maybe I'll still work a little bit and everything like that. You really can't. Like there's no time. Pretty much every waking minute is studying or going to clinical or satisfying all those different requirements. But so that's kind of how the program's laid out. So I'm in my second semester, part of the AHAD and Thera, just around the midterm point. And then this coming summer, I'll have like an integrative practicum, which similarly to the like an undergraduate integrated practicum, it is a full-time placement, but we do also have class in addition to that. I think it's just 1 day a week, kind of in the evenings type thing, but there's still exams and everything like that. And one thing I would just mention too, kind of interesting in terms of the program, anyone that's kind of looking at what experience is like in the program, is that we have written exams, like the one I had this morning, multiple choice, short answer, that kind of thing. But we also have our OSCEs, which are the standardized patient exams. So where they give you like a specific situation and it's your role to, you get 20 minutes to do a full assessment and then at the end diagnose, and then a verbal exam at the end saying like what you would do and stuff like that. So that's been interesting. It was kind of a bit of a learning curve at first, learning how to be examined in like a clinical setting like that. But once you do it a few times, it starts to become a bit better. But we have more at the end of the semester and more in the summer. So lots of opportunities for that.
Great, thank you. Thank you for sharing that insight. I mean, maybe that was a good question for like Eugenia and Michelle. How do you find the like work life balance with being in a thesis-based program and working and managing your school expectations?
Mine is a little bit trickier because yeah, I have 3 children also. So that's pretty tricky. In terms of the school, yeah, they say 15 hours of readings a week per class. So that's 30 hours plus your class time that you have to set aside. So they really discourage working over maybe 1 shift a week that you could probably manage. I have a standing shift on Tuesdays, so I was able sort of to keep that 1 shift going. And then I picked up a bit at the beginning for COVID in emergency departments and things like that. But overall, yeah, it's pretty demanding. But there is part-time options. So I'm in the full-time option, and so is Eugenia, but there is the option to do it part-time if you want to keep working. And then some of the courses you can pick online classes also. So that might be a way to sort of balance a bit better. I know that most people are able to, yeah, sort of juggle the 1 or 2 days a week. In the full-time stream of the thesis, there's also the opportunity to be a teaching assistant. So that is another way to supplement your income while you're a student.
Great, thank you. Eugenia, do you have anything you'd like to?
Yeah, so to add on to what Michelle was saying, I think our experience is a little bit different because I do not have children. But the full-time program is generally for the thesis-based streams, I'd say at any school is 2 years, and we are currently in our 3rd year. So I would say like if you do end up completing the entire degree in 2 years, yeah, I would say you'd only really be able to work once a week, 1 shift a week. But that being said, of course, not working full-time hours. It does take, there is like a bit of a financial burden, but depending on which school you go to, there are funding opportunities, and McMaster, of course, I'm a little bit biased. But yeah, McMaster has a lot of funding opportunities for their students. And then for me as well, I am an RA, a research assistant on the side. So I put in about 10 hours a week for that position. But that being said, because I'm doing this program over a course of 3 years, I have a bit more time to be able to pick up more shifts once my course is finished. About a year and a half into the program, once my course is finished, I had a bit more time to be able to pick up more work at the hospital. But recognizing that that's at the expense of working on my thesis work as well. So it's really just a balance between everything. And then where your priorities lie, and you may have to sacrifice some things over others. Yeah.
Yeah, great. Thank you for sharing your experience and perspective on that.
Sorry, I didn't mean to interrupt. I just wanted to
Oh, no,
add,
go
in
ahead.
case anyone was curious, I am in the full-time for like NP program, but there is a part-time option as well that people will do over like 4 or so years, and then in that case you'd be able to work like once or twice a week or something. Yeah.
Great, thank you for sharing that. And then so this is now a question back for all the panelists. How did you find the application process for your graduate studies? And like, was there something that you wish you would have known during this process, or anything you think is important for someone who's interested in applying to know?
The biggest challenge for me was that I had been out of school for a while, so I was like nervous that my undergraduate professors wouldn't remember me, but there was 2 that still taught there and they both remembered me. So that was, or remembered me. So that was great. So I lucked out, but yeah, sort of asking the right people for references and just being really clear. They really want academic references in our case. NP might be different because it's more clinical. The biggest thing I wish I knew was, as Eugenia was saying, the funding opportunities. The thesis stream gets double to triple the amount of funding that the course-based stream gets. And honestly, if I had known that, I probably would have A, chosen it first, and then B, I might have even done it sooner than if I didn't. I thought, maybe like they don't guarantee any funding, but it's been our experience that it's, we're essentially able to go to school for free. So I wish someone had told me that when I was applying, because it would have been a huge motivator for me to go to graduate school earlier, knowing that there was this huge funding opportunities for research-based nursing programs. So I guess I wish I knew that.
So I will add on to what Michelle was saying. I do have 3 things that I wish that I had known during the process. So one of them, like Michelle mentioned, was finding academic references. That was really difficult for me as well. So if anyone is applying or planning to apply to the program, I would, especially if you are already in your undergraduate degree right now, I would start building relationships with your professors now. They can help you find research opportunities while you're an undergrad, but then of course they can support you in being your academic reference later on in your nursing career. I didn't build any relationships with my professors, so I was cold emailing them, and it was really stressful for me. So that's one thing. The next thing as well, which is what Michelle also kind of mentioned, was the supervisor that you select is really important. I have already mentioned the student supervisor relationship, but the supervisor that you select can also provide you with a lot of different opportunities. So when you are looking for a supervisor, think about maybe the research department that they work for or are associated with, especially if that research department aligns with your interests. Look at the different research projects that they're on, that they're currently working on, because then that may help you get connected to an RA position as well that you may be able to have during your graduate degree. And then I think the last thing that I would advise for anyone who's planning on going into their graduate degree would be knowing why you're going into the graduate program, and then seeing if it aligns with your long-term goals. And so this may be even looking at graduate programs outside of the nursing field as well, because I've talked to a lot of different people who have completed their nursing masters, but unfortunately they don't end up using their graduate degree. And so it's a really long journey, the program itself. So it's important that, you know, you choose the right program for that'll help you achieve your nursing goals in the future.
I just want to quickly add that I did do that also. I called or I set up meetings with a few deans of different graduate programs to sort of see if you know, they were appropriate, like what are they offering? This is my goal, is this, do you think, what I should be taking? So yeah, it's a lot of putting yourself out there for sure to make relationships and meet people and sort of figure out the right path for you. But it's really important too, because yeah, you definitely don't want to spend your time, because it's a lot of time doing something you're not totally interested in.
I can speak a little bit to the application process in terms of the NP program as well. Sounds quite similar. We needed the academic and the clinical reference as well, which is kind of interesting because we don't do as much of the research portion, but I guess for that first year, it's still quite relevant. So yeah, we still needed our academic, clinical, and then like a paper type thing, which looking back is interesting to read, but after you've been out of school for a few years and then write a paper to get back into school. But other than that, there are some different, because just in the mention of funding and stuff like that, there, depending where you live in the province, I know Western's part of it. I'm not so sure about the other schools or which ones are all part of it or not, but because of the shortage of primary healthcare providers in rural areas, and because London catches like the whole kind of southwestern Ontario, they're offering free tuition for like new entry nurse practitioner students as well. So not for me because I'm in my second year now, but any new entrants, that what I've heard is that they're offering free tuition, which is kind of nice and something good to consider. But yeah.
Great, thank you. Thank you for sharing that. That's good to know. So that's all the formal questions we have today. Thank you to all the panelists for participating in the webinar and sharing your insight. So now we'll just give it over to attendees. If any attendees have any questions, please feel free to ask now in the chat or turn on your mic, whatever you prefer. I think we did get one. Oh, there's one question in the chat saying, I was wondering how many years of experience as a nurse would you suggest before going into graduate studies?
For clinical-based masters, I would say you have to have 2, but I would imagine, you know, Danielle can talk more about probably, you know, a little bit more is great. 4 to 5, probably get in there. For the research stream, like, it helps you to ask good questions when you have a great clinical background. That being said, to actually do the research, if you're interested, there's really no reason to work clinically, and they're even sort of encouraging that a lot more in the research world. But I think, as Eugenia said earlier, like really knowing what your long-term goal is. If you want to be a clinical expert and that's why you're getting your master's, or you want a leadership role, then you definitely need more clinical experience. And if you are hoping to be a researcher and work in a lab and sort of go that route, it's not as clinical focused.
Yeah, I'll just add to that just in terms of the clinical part. Like Michelle said, 2 years is the minimum that you need to apply to the NP program. However, I would recommend getting a little bit more than that. So I did about close to 4, and I can't imagine having done it before that, just because they rely very, very heavily on having strong RN assessment skills. And it's also in terms of the actual what clinical experience you're doing. If you're interested in the NP program, I would like they kind of mention, but I would like validate the fact that any like more sort of like acute episodic emerge ICU, that kind of thing are like the really good experiences to help you with the NP program. I find that even some of my colleagues, like in my class that I work with, who don't have as much of that experience, they pointed out, they're like, oh my gosh, like I can't believe like how much things just come together a little easier for you because you've seen so many, triage so many patients with so many like acute little concerns and stuff like that. But so yeah.
Hey, thank you for sharing that. Does anyone have, well, leave it open. Does any other attendees have any questions? No, I don't see any coming into the chat. So I think that's all we have for today. Thank you everyone for attending today's webinar. Thank you again to our panelists for sharing. If you guys do have any questions, I don't know, actually, we just got another question. Are there any job opportunities postgraduate?
The most job opportunities possible. Is that what you mean? Once you get your master's, you are unbelievably employable. Like you are highest of high demand. You can work anywhere you want and do anything and get paid whatever you want.
It's good to know. Yeah, and so you guys put your emails in the chat. So if any of the attendees have any questions later on and want to ask, is it okay if they send? Yeah, so feel free to reach out. Great. Thank you for sharing and providing some insight. I think that's, if anyone no questions.
I will add as well, I think Michelle and I are a little bit biased being in the thesis-based stream, but I think it's important to consider, once again, like what your long-term goals are. But I did just want to say that if you do pursue the thesis stream route, the doors that you have are more open compared to if you go into the course-based. Just because the thesis-based stream, you develop a lot more critical thinking skills through research, and the skills and tools that you have, you learn a lot more in comparison to the course-based stream. I don't know if Michelle has anything to add to that.
And if you're interested in a PhD, you don't have to have it, but it does make you more competitive having the thesis masters. They very strongly encourage it. But that being said, if you do a master's in nursing or a master of education even, it sort of depends on your research background. So sort of your research experience in combination with your graduate school. So yeah, a few more doors open, especially at the university setting, if you have the thesis stream. But the college setting is Masters of Science in Nursing is sort of how you get into that teaching stream.
I was just going to say, I like what Eugenia said about kind of looking at what your goals are and where you want to be and stuff like after you complete your graduate education. Because when I was first deciding what I was going to do, in terms of graduate studies, I considered lots of different options. But ideally, because my husband and I live 2 hours away from any academic setting, and there's probably no one with a master's of nursing within an hour of where we live. Not that, because it's just the reality that there's not as many opportunities in the rural, like they wouldn't acknowledge it as much as they probably should, or that they could use more educated, situations. But so that's why I ended up choosing more of a clinical route to graduate nursing, because there was more, that's what's kind of needed in the area where I want to live, which is too bad sometimes because I did enjoy the research part a lot as well.
I have 2 NPs in my PhD program, so you never know.
I've
Thank
had
you.
a couple of the professors and stuff mention that, like, it's great. Like,
Yeah, well, Denise Bryant-Lukosius is like the internationally like world-renowned researcher on NP. She's like creating the APN role on a, a standardized sort of definition. So there's lots of research into the NP role also. Just another research plug.
That's good it's great to hear and good things to consider when applying. I'll leave it up. Does anyone else have anything else they'd like to add?
Any more questions in the chat?
Fine. I think that's all. Okay, well, again, thank you everyone for attending. We hope you found this helpful. Well, we did record it, and I'll just stop the